Hello, everyone. Welcome to our first meeting of the Minds discussion for the next 2 days. This is our second annual State of Mind Symposium with Connect Summit County. Our mission at Connect is to create a well-informed and stigma-free community with access to mental health resources for everyone in Summit County. In order to do this, we must talk about the places where mental health is a factor, and that's not just in the office with a therapist, but also how mental health impacts our citizens. For instance, those with physical conditions like POTS, migraines, dizziness, and other neurological conditions. In all of our meetings of the minds over the next 2 days, we're going to be talking about equity and self-advocacy because these are issues that span throughout the treatment of all mental health. I want to thank our donors for supporting Connect Summit County. We are here to have meaningful discussions about mental health because of the Marriott Daughters Foundation, the Cats Amsterdam Foundation, and the Park City Community Foundation, and so many other generous people in our community. So we really thank you. Before we begin in earnest, Betty Morin, our events coordinator, is going to share a few ways how to be engaged and how to Zoom chat. And there's also Facebook comments for this event.
Oh, Lauren, thank you so very much. I appreciate that. So like Lauren said, I am Betty. And I just wanted to remind all of you that this is being recorded and shared on Facebook Live. Feel free to turn off your video for any added privacy and stay muted because we're going to do our best to only record those who are speaking during this event. If you have any questions or comments to share for our panelists, we would love to have you put those in the chat. We will do our very best to answer questions while we're here, and we'll also do our best to, if we can, answer those questions afterward if we don't get to all of them. So thank you all so much, and Lauren, I will hand it back to you.
So we have a real treat for you today because we have an incredible group of panelists. I'm going to start with Janine Holmberg, who I like to consider a mentor of mine here at Intermountain. Janine is a doctor of physical therapy, and she specializes in vestibular rehabilitation. And she actually helped to establish and build Intermountain's Hearing and Balance Center in Salt Lake City. So all you dizzy folks out there who've had treatment there can thank her for that. She's got over 30 years of experience in treating a wide variety of vestibular and neurological dizziness and balance problems. She's currently working in a leadership position for Intermountain Rehab Services, where she fosters collaboration, best evidence care, clinical research, and mentoring, in addition to keeping a small clinical practice at the Hearing and Balance Center, so you can still see her. She is a respected, skilled clinician and mentored many in her field of expertise to better manage the complexities of dizzy and the unsteady patient. So Janine, thank you so much for being here today. Up next, we have Dr. John Pertab, who is a doctor of philosophy and clinical psychology, and you got obtained that at Brigham Young University. What's fascinating about John is that he's actually from New Zealand, and he started his clinical career over there in New Zealand, focusing on neuropsychological rehabilitation, anxiety disorder treatments, and health psychology with children and adults. John spent time serving as the director of the Neuropsychological Services at the Salt Lake Center for Human Potential. He's published research in the area of pediatric and adult traumatic brain injury and is currently active in several neuropsychological projects. Now, what isn't included in his official bio, so I'm going to say, is that he is an excellent advocate for patients both with concussion and dysautonomia. John's article on dysautonomia and systematic review was absolutely incredible and foundational to our work that we did up here in Park City on dysautonomia. So we really appreciate him, and we're honored to have him today. So thank you. And then our last panelist is a friend of mine and an acupuncturist extraordinaire. So Autumn Bear. Her formal training is in classical Chinese medicine through, okay, I'm not going to say these right, so I'm really sorry, but a Taoist master and an 88th generation practitioner, Jeffrey C. Ewan. Her master's of science is in acupuncture. Autumn has a fascinating life story of how she got into acupuncture. So she's a very well-rounded, incredible individual. And she had the great privilege of teaching as a professor at the Pacific College of Oriental Medicine in New York City, as well as integrating acupuncture into mainstream medicine at the University in Paris and the Wu Ming Dao Healing Center in Moscow, Russia. So her passport has a lot of stamps in it. She is a COVID transplant, so we stole her from New York City here to Park City community, and she's using her incredible skill set to help our community members here up in Park City. I'm sure she sees people from other areas as well. She's specifically helping us with patients with autoimmune disorders, migraines, and dysautonomia. So I'm honored to be able to collaborate with her, especially on my more challenging patients who need a little bit more attention. So thank you all for being here. These experts work with patients every day who are looking for answers for symptoms that they've been dealing with for years and were continually misdiagnosed. Moving through a diagnosis, feeling ill, trying their best to get better, and not thinking of the impact it's all having on their mental health. What's worse is that there's so much stigma around the topic of mental health that it's hard to even start a conversation about treating things like depression and anxiety, along with these other medical conditions that we're going to talk about today. So I hope everyone is excited to learn. These are all big, heavy topics. I have charged each of my panelists with introducing the general overview of dizziness, dysautonomia, and migraines in 5 to 10 minutes. They each could talk for 3 days. But let's start with, in the order of introductions, Janine, I'm going to ask you to give us a brief overview of dizziness, please.
Nice. And I will go ahead and share my screen. Can you guys hear me okay? And let me just get this shared. Okay. And let me get this going. All right, so I can't see you guys anymore, but I'll just, hopefully someone will tell me if you can't hear me or if you can't see. Can you see my slides okay? And if I don't hear anything,
Yes,
I'll just
we can see
yes.
your slides, Janine.
Beautiful, beautiful. It's an honor to be here. You know, one of the most important things we do in healthcare is make sure we connect and reach out and understand and educate, and really good healthcare is this collaborative between what we know as professionals and what you guys know and the wisdom of what you're going through with your problems that you're dealing with. And so my background is really in inner ear and dizziness problems, which is going to kind of be perhaps a model for other neurologic disorders, because we basically know that chronic dizziness or any neurologic problems can be tough on us, can be tough on our nerves, tough on our brains. And we know that healing chronic dizziness is no different than some of the myriad of other neurologic things that are out there, but it can require a lot of what I try to tell my patients, the 3 Ps, patience, persistence, and perseverance. And you got to be tough, dang it. You got to be really tough, and you got to have some resiliency that hopefully you can get a lot of support with, and you need to reach out for support because no one runs this journey by themselves. And what we know about chronic dizziness is if you have a neurologic problem like an inner ear problem, or you experience a certain type of migraine that triggers dizziness, it can cause some shifts within your brain. So it's actually soft-wired problems. That's different than, we usually go to the doctor, is there something wrong? Is there a tumor? Is there a stroke? But we know that, traumatic things can really cause a lot of functional shifts that can complicate our healing. And they can also, just by themselves, trigger an understandably high and disabling amount of anxiety and depression that needs to be worked on at the same time you're going through the healing path for the original neurologic problem. And we actually know also that just anxiety by itself can create a lot of chronic dizziness problems. And so when I talk with my patients about chronic dizziness, I talk about, how either after you can experience something that made you dizzy or made you have vertigo. And about 70% of the time, that's probably coming from this little inner ear of yours, the brain from a migraine, or some kind of medical crisis like dysautonomia, or you had a syncope event where you passed out, or you could actually just have 50% of the time, maybe you had a panic attack, some kind of heightened anxiety. And when that happens, we experience something that's really traumatic, which an acute dizziness crisis can be. Our brain goes into full fight or flight. It figures out how to keep you safe. It starts watching out for the environment, starts guarding you. And then we know as that neurologic problem or that dizziness problem heals, that you're supposed to go into this beautiful area of nirvana where you've adapted, you've healed, and you've recovered. And we know a lot of people can do that. But because of some predisposing factors, not because of any fault of your own, sometimes high levels of anxiety, or if you have tendencies to be kind of obsessive compulsive like myself, or you tend to, have not got enough support and you don't know what this is doing and you feel like, my life is feeling shattered, then you can actually, your brain actually can go into this, what we call a maladaptation, where you start feeling more sense of threat. You start attending to things your bodies are telling you. Understandably, you start, and your brain actually goes into kind of a distortion in how it's processing things. And we know that in order to get back to this healing zone, we have to be able to kind of do some rehab, maybe do medications, and actually integrate the two domains of medical treatment and psychiatric treatment and behavioral health treatment to get your optimal healing. And so we know that chronic dizziness is really highly interactive with both anxiety and depression. And sometimes it can just exist by itself because you had this horrible migraine, you had this horrible neurologic event, you had a concussion, maybe you had, some kind of event that really has pushed you into this different zone. And I know, medicine is just starting to understand this direct interaction with how a direct neurologic insult can create a functional shift in how our brain is working. And that interacts with our sense of well-being and how we're processing things. And I love, there's this wonderful, wonderful website that actually is starting to talk about this neurosymptoms.org, where it talks about, very often you'll go to the doctor and the doctor can see if, you had a tumor, you had a stroke. That's what we call a structural problem. But we know there's tons and tons of problems that happen with the functioning. And so when I deal with my patients who have dizziness, it's literally because the function of the brain has shifted. That delicate neurochemistry has shifted. And we can actually, if we actually took some of my patients that have chronic dizziness for definable reasons, we could put them into different things and we can see widespread changes in how their brain is functioning. So your brain lights up different. We could actually take a picture of how your brain is processing things and it would actually look different. And there's lots of funky names in there. But basically it says that if I put you in a roller coaster, a virtual roller coaster, which we know we can do in today's world or at Disney World, your brain would look different. Someone who's dealing with chronic dizziness would look different than someone who has not experienced the same thing. And so we know that these powerful treatments with education, with certain medications that they can use, and behavioral health therapy and physical therapy can really, really help. And so with that, I just want to turn it over. So just the bottom line is that, we absolutely know that there is so many things that can cause us to go into chronic shifts and that there is definable stuff that we can do. And so that's my journey from a dizzy standpoint. And so I'll pass it off to our next panelist.
Thank you so much, Janine. We could unpack that for days, which I know that you can do in your presentations. So Dr. John Pertab, if you are ready, let's have you introduce dysautonomia, please.
Yeah, sure. I'm just going to share my screen here. Can you hear me okay?
Yes.
Yes.
Okay, great. All right. So dysautonomia, I myself, I work a lot with patients with concussion and brain injury, and I stumbled across this concept because I had quite a few people who had injured themselves while fainting, and that's one of the symptoms of dysautonomia. And so I looked into it a little bit and discovered that a lot of the symptoms of dysautonomia overlap with symptoms of concussion, and sometimes can be misdiagnosed as brain injuries when actually they're not. But it's quite a fascinating field, and so just as a little introduction, I know it's a big fancy name which doctors like to do to make themselves feel special. I think give it a big fancy name, but basically what it's relating to is something wrong with the autonomic nervous system, and that's a part of your brain that controls a lot of the automatic things that your body does, and generally helps you adapt to the environmental demands. So for example, if it's cold outside and you get goosebumps, that's controlled by the system. If it's very dark and you want your pupils to dilate, that's controlled by the system. If you've eaten a lot of food and you need to digest that, if you're feeling romantic and you want your body to respond to that, then that would be also controlled by this system, the sexual response cycle. Often how it does that is through blood flow. So if you've eaten a big meal, it would send more blood to the digestive system so you can process that meal. And it helps you maintain balance in a lot of different ways. And if it's disrupted, you feel it in many different ways too, not only physically. So for example, irritable bowel syndrome, I've got a whole list of things, but you feel it physically, but also emotionally. Like when this system's not in balance, people are very much more prone to anxiety, insomnia, depression, those types of things. It interacts with our hormones and with the immune system, which are the two other kind of main system that helps our bodies respond to the environment effectively. I'm not going to go through all of these, but I'm sure if you skim through them, you'll see that there's just an amazing array of symptoms that are related to when this is not working efficiently. These are the kind of problems that people can have. And very commonly, gastrointestinal symptoms are related to this, and also emotional symptoms, as you can see there. Pain symptoms as well, which is kind of relevant. At its extreme, you can also get blood pressure regulation issues, because that's one of the things that this system helps with, heart rate and stuff like that. So fainting, feeling lightheaded, and dizziness, as Janine was talking about also. These are some of the conditions. Like if you have these conditions, it's likely that your autonomic nervous system has been impacted in some way, and learning how to stabilize that can also help address some of the symptoms that you may be struggling with, both the primary ones, but also secondary ones. So primary, I mean, like if you have depression, you'll have low mood. But if you can effectively manage the autonomic nervous system, it could be all by itself, your mood will improve. So medications, you have to kind of keep an eye on those, especially if you're prone to blood pressure regulation issues. And sometimes the treatments that doctors use to treat things like concussions or emotional problems can create their own problems, and there's a list of them there. And I honestly, please don't change your medications without talking to your doctor. I'm not advocating for that, but I would say also a lot of doctors are not aware of this, partly because it's not really emphasized in training for psychologists or physicians in general. So that's something to be aware of. Yeah, so this is a pretty interesting website, but as you can see, there's not much of the body that's not impacted by dysautonomia. When I'm working with a patient who is suspicious for one of these conditions related to dysautonomia, this is usually my base program that I developed originally for concussion, but is very applicable to any of the disorders that I listed there: depression, anxiety, pain conditions. Like if you can get this right, your chance of healing and addressing your symptoms and responding to other types of therapy like balance therapy or psychological therapy or speech therapy or physical therapy, I believe goes way up. So I think it's not easy to implement these changes, and my role is to just do that in a stepwise fashion with many of my patients so they're not overwhelmed. So just seeing this slide, it's kind of like me handing people a piano book and saying, go learn, play the piano. And maybe there's 2% of people who have got the ability to do that. I'm not one of them. But I think most people need support to make those kind of changes. So that's probably all I have for me. I'll stop that share and pass it back to Lauren.
Awesome. Thank you so much. Okay, and then last but certainly not least, we have migraines and Autumn. And then Autumn, if you want to sprinkle anything else in your intro, go right ahead to your topic.
Okay.
But remember, like 5-10 minutes, okay? Don't sprinkle too much.
Yeah. How does the person really boil down 5,000 years of history into about 5 minutes? It's kind of a task, isn't it? I thought a lot about how to address this. So obviously I'm coming from an East Asian medicine perspective. And one of the things that I wanted to do is to just back up a little bit and talk a little bit about what that even means. I think there's a lot of people that don't even know that things like acupuncture can be utilized for mitigating some of the symptomology for migraines, for dizziness, for dysautonomia. And it's one of the things that I think is really important in terms of advocating for supportive therapies, because there really is a huge amount of things that we can do just working within the confines of each person's own body. And part of the way that we do that is the way that acupuncture is, I guess, systematized. And so I kind of wanted to just describe a little bit about what acupuncture does, because most people know what migraines are, but they have no idea how acupuncture could even be helpful in any way. So one of the things that I like to talk about is really just understanding that acupuncture is a system that integrates channels that run through the body, just the way that we would think about our neurological system or our blood vessel system, our circulatory system. We look at things from a channel perspective, and these channels have 365 points on the body, and those 365 points are utilized not at once. That would be really intense. Basically, we have to selectively use certain points to help manipulate and elicit a response in the body. And one of the things that's really interesting about migraines in particular is that we're really looking at not just what are migraines, but we're looking at the whole person. We're really looking at, what's going on with this person. Is this person coming in? What does their diet look like? What is their lifestyle? Has there been trauma? Is there something, physiologically, or is this emotion based? And how do these two pieces work together? When I'm looking at these migraines in particular, I'm looking at a snapshot of what we call the humors in Chinese medicine. And the humors are basically our resources, right? We've got energy, what we call qi, blood and fluids, right? These are the basic fundamentals of what we have that support and finance our daily existence. When we look at these aspects of the resources that we have in our body, we're looking at when a person comes into my office, I'm looking at, is this person coming in with what we would like to look at as an excess or a deficiency? Migraines can come in a lot of different ways. So in particular, we've got these like sharp stabbing ice pick headaches that feel very different than the squeezy, intense all over the head type of headaches. And those different aspects, the qualities of those migraines give us an indication of whether this person is suffering from some sort of humor deficiency or an excess. And then we're looking to basically balance out these humors to try to figure out how can we systematically look at the person and gauge what the person needs both internally and externally. Now, where anxiety comes in, and I think this is kind of the interesting aspect of looking at acupuncture as a system. So we'll talk about blood for a second, because blood is one of the most important humors in the body. And, from a Western perspective, obviously circulation is super important. And we have to look at that avenue. But in Chinese medicine, blood actually houses the emotions. And when we look at someone, for example, if someone comes in and they have a deficiency, if they don't have enough supportive blood in the body, there's nowhere to house those emotions. So where are those emotions going to go? They usually go outward. So the expression of emotions like anxiety is usually a really good indicator for us that there's an imbalance. And simply an imbalance, just the way that we would think of inflammation, or we would think of like if someone broke their toe and you say, oh, I have this really painful toe. Anxiety in Chinese medicine is very much an indication that there's just a simple imbalance that really needs to be looked at seriously and be taken seriously and we look at that just as we would look at if someone had migraines. And so obviously collectively the two together, usually in our indication, and we try to look at those two pieces together because a lot of times they go hand in hand, and they're usually symptomology of a particular pattern that we're just looking to rectify in the body. I think something that's also really interesting, you know, when we're looking at the whole person system, you know, we have to look at how does anxiety fit into this person's life? Is it something that's overtaking a particular avenue? Is it setting the stage for all of the other symptomology, or is this something that's just a byproduct of something, maybe a trauma that they experienced? And then it's really common for someone to go through big trauma, whether it's a head trauma or a surgery or any of those types of things. And the exhaustive measure of that trauma can really exhaust their humors. And so anxiety is one relationship that we have with the body that is really, it's really easy for us to see how those two pieces go together. I think the other thing that's really interesting about Chinese medicine is the fact that in our body and physiologically, we have 5 different components of what we would call the spirit. And I know this is kind of a really interesting topic to talk about, but I think that when we're, you know, talking about Chinese medicine, we have a lot of terminology that is very old and antiquated terminology, but the application of it is still completely valid. And so we look at the fact that when we look at a person, we have to look at not just, you know, are they suffering from migraines, but we're looking at this whole person and the alignment of their humors, how their body is being supported, what does their diet do to influence them. And I would say in my practice, not so much as it pertains to dysautonomia, but I would say that in my practice, a huge portion of people who come in with migraines also have food sensitivities. And in many circumstances, those food sensitivities are actually what's catapulting them into a state of migraines on a regular basis. So, you know, when we're looking at addressing things like migraines, we really are looking also at what are some of the underlying possibilities of their life and existence that could be contributing to these factors, and how can we suss out those aspects. We like to really look at how we can treat the root cause of someone's migraines or dizziness or dysautonomia. And how does that essentially affect the branches, which is our symptomology. So I could probably go in forever, but I think this is probably a good place to stop.
It's so interesting. Thank you so much, Autumn. I'm so excited that we have Eastern and Western medicine on this panel today, because, you know, we all are saying the same things, but we're saying it in such different ways. And I think that's so important for patients to hear. Might resonate with one person differently than it does with another, right? So let's get into our questions. The chat is open. So if there's a question that we aren't going to get to in our list of questions, it's really important, we will go ahead and skip over to that, and we'll infiltrate those into our process. So many people in this situation have been invalidated by a previous provider. We're going to start with the heavy one. So you've had this chronic symptom that's going on, be it migraines, dizziness, or that myriad of symptoms associated with dysautonomia that kind of confuses a lot of our providers. And so you're kind of written off as just having anxiety or depression. And this is part of that journey to diagnosis until you find that right person. So for each of you, what's some advice that you can give to a patient about navigating or advocating for themselves? And let's start with Dr. Pertab, and then we'll just kind of move around between all of you, and please communicate with one another and have an open discussion about it, because this is the big one about that patient experience.
So do you mean like someone who's got dysautonomia kind of symptoms, or dizziness?
And maybe they've seen providers and the provider's not quite sure, why do they have this IBS and this headache and all these symptoms? And so they label them with anxiety or depression with no further follow-up. So how do we validate that experience moving forward?
Yeah, I think, you know, part of the issue is that most physicians are either really general, so they don't have a lot of in-depth knowledge of particular specialty conditions, or they're specialists. So, you know, if you go to a gastroenterologist for your irritable bowel, they might treat it as a bowel issue rather than something that might be related to the brain, the autonomic nervous system. So I think that's actually a common feature of a lot of patients, is it's very rare for people to actually have a holistic approach to, I don't know if it's super rare, but you know, the average doctor might not take that approach. So I think the other thing is, like, I think it's okay to be skeptical about physicians. I know some of them think that they're godlike, but really they're not. They just have an opinion, and if it doesn't really match how you're experiencing the world, you should trust that. I would say that's my impression. And then I think keep shopping. There's so much information on the internet now. Some of it's total rubbish and some of it's reasonable. But I think finding out what other people with your symptoms have come to and what's been working for them on the internet, and then looking at seeing what specialists actually take that approach of validating what you're going through. I do think it's growing awareness of these variables in the medical field, but some people are not quite there yet. That's my thoughts about it.
Yeah, that makes perfect sense. And it's important to remember, especially in dysautonomia, the average patient takes 5 years to get diagnosed and see 7 providers before they get an official diagnosis. So some of these conditions are going to have a little bit more of that filtering through the healthcare system than others. Janine, how about you? Because 3PD is gaining awareness, but I wouldn't say everybody knows what it is. So what would be something you would say to a patient? Yeah.
Yes, to, like John said, to never lose hope, because very often you are going to have to be your own best advocate and just say, I'm not getting enough answers here. I would like to, where else could I look? Where else could I look? Could you push them towards, what other kind of forms of healing are there? You've offered a drug. Is there a therapist that I could go to? Do we really have all the answers, and really push them and realize that you come to that table as an equal participant. Your experience is vitally important. And if you feel like you're not being heard, then you need to get to someone who can hear you. So, and then just really push, because the potential for healing, there's a lot of potential for healing, and we all have our own journey, and we all have different people who need to advocate for us. What kind of therapist do we need? And so just keep working, because the power for healing, if we know anything about our bodies and our brains, is incredible capacity to heal, incredible capacity to heal. So if you don't feel like you've gone far enough, know that there's somewhere else. So just keep working and keep advocating.
Thank you.
If I could just
Yes.
clarify, Lauren, after you spoke about dysautonomia symptoms, and I think one of the classic presentations of that is unexplained fainting, unexplained lightheadedness, unexplained dizziness, unable to exert, really high levels of fatigue. And so those are, I think, when you talk about dysautonomia, just a heads up to everybody, that's probably some of the common presenting types of issues.
Yeah, and with chronic dizziness particularly, triggered by something that was very identifiable. How you had an inner ear problem, you had a migraine, but now your provider's saying, well, it should be healed by now. In fact, we did some testings to show that the ear is healed. So I'm not sure why. And so that's where we're trying to really get the word out, is that, a definable inner ear problem can really trigger a cascade of things that need a totally different approach. So yeah, it's tough. Navigating the waters of the medical system can be a fine art.
So that brings us to Autumn, because from what I know about Autumn's practice as a patient of hers, she tends to get people towards the end of their traditional medicine course. So she tends to get the people who have really been through it. And so Autumn, what insight do you have to these people who have had maybe an intermittent positive experience, or they have a little bit of a heavier emotional burden because of their journey?
I think what's important to, at least, and you're right, I usually get people who have gone through a tremendous amount before they get to me. And they may be coming in with a diagnosis, but in a lot of circumstances, they'll come in and they'll say, they've told me this is what's going on, but there's really not a lot that they can can do, or here's the list of drugs that I can take, and or they've taken every single drug and they don't feel super great. And I think I just want to, you know, reiterate exactly what Janine said and what John said, just that, you know, going through a diagnosis and going through any sort of illness, it is a journey, but and you want to build a team of people that are really rooting for you and that are offering you really good resources. And I think finding and understanding what those resources are on both the Western side and potentially the supportive side with acupuncture, herbs, you know, a lot of times people will come in and they'll say, you know, I don't feel well, here's what's going on. And I always like to tell them, you know, there's always a solution. It just sometimes is a little harder to find. And so let's find you all the potential resources that we can. And I do think that it's really important that you find a team of people that are well educated and how they can refer really good support systems. What, you know, obviously by the time they get to me, they've already gone through a huge amount of, you know, they probably already have a therapist, they're going through physical therapy, they've seen multiple doctors, etc. But, you know, that doesn't mean that their journey stops there. You know, there's a lot of supportive systems besides acupuncture. Obviously, there's herbs that are involved. There's also things like cranial sacral therapy and Feldenkrais. And there's, you know, a whole host of things. And I think it's really important that we educate ourselves as practitioners so that we can find the right fit for those patients and really get them to the places, even if it's not from us, you know?
Yeah, one thing to add to that, Autumn, is like, you can't really just rely on a specific specialty. Like some neuropsychologists are going to be aware of what we're talking about here today, most are not. And probably the same with acupuncturists, physical therapists, hearing and balance vestibular therapists. So I think my rule of thumb that I talk to patients about is if you're trying a treatment for a couple of months and it's not having much impact, probably talk to the therapist about maybe it's time to move on and try something. Else. That doesn't mean you have to try a whole new field. Like I've had a chronic pain issue and I saw physical therapists, chiropractors, all sorts of people. It was only the 6th and 7th person that actually helped me. So, you know, I think that's a common thing. People have said, I've tried acupuncture, I've tried this and that, but each clinician is going to approach it from a bit of a different way. So keep trying.
And you have to find the right fit. I feel like with any physician, you know, you can try, you know, 3 different GI specialists, and there's going to be one that really, really talks to you and really helps you in the way you need help. And there might be 2 that are going to do their best for you, but may not be a good fit. And you really have to find the right fit and the right team to support you as you go through. Because you know, Janine even said in the beginning, like, this is not a journey you have to take on your own.
I think these are all such great points. And I also think that this kind of brings up an underlying topic. And I want to give a plug to the panel discussion on Wednesday about healthcare inequity, because here we're talking about if the first provider doesn't work, you may have to go to another, which is wonderful. Continue to advocate for yourself, continue to search for the answer from the person who has it. But then there is that talk about inequity and cost and time and things of that nature, and health education and knowing where to look. So make sure that you check out our panel on Wednesday to learn a little bit more about health equity. So I want to move on to our next topic because we have so much to get through today. So how do anxiety and depression play a role in specific diagnoses? And why do we need to treat both the physical and the mental impact? And I think each of you kind of talked about this in your introduction. But I would love to start maybe with Janine, because Janine has talked a lot about dizziness and this vestibular autonomic pathway, and I find it to be totally fascinating. So I want to start there, and then we'll go on a backward circle.
No, this is a great subject. You know, when your body sustains a threat of some kind, you know, whether it be a migraine and an ear problem, it wants to protect you. And so that it's really normal that the anxiety system goes on hyperdrive and wants to try to take care of you. And in fact, we know from an inner ear standpoint that the type of things that need to happen while you have an acute inner ear problem, meaning you need to be watching things carefully, you need to be more body vigilant for the few weeks that you're healing. And then sometimes that can get stuck. So it's just very common that when you're dealing with a neurologic injury, that your flight system is going to be very much on alert, very much on hyperdrive. And what I tell my patients is that if we can address both the underlying cause, so you have an inner ear problem that's going on here, but could we also address the fact that your fight or flight system's overly protecting you. And we know that that anxiety system doesn't have what we call a brain. It just wants to react, and that we can actually help it calm down. And that, what I love about Eastern medicine is that they've figured out that there's this holistic approach that needs to happen to healing, that we don't control healing. We have to awaken healing, and we have to be able to look at ourselves from our whole body perspective. And that could it be that if we could elicit a level of relaxation, if we could elicit, it's almost like the most magical, amazing pill you could ever take, because you open up that body's pathway to heal, because the brain can heal, the bodies can heal, and we sometimes get in the way. And so depression, anxiety can escalate to a level that is actually kind of blocking our healing pathway. So it's just powerful to embrace both of them at the same time. Can give you so much and open the healing. I've often described when my patients practice meditation that you are going to a space of healing, and you're awakening and letting that body do what it knows it can do and do so well. And so it's fascinating, and it's really a beautiful thing. And one of the things that I love about being a healthcare professional is to watch someone awaken that. To be in the room when someone awakens that deeper healing, whether it came from a counselor or a doctor with a medication or just the right exercise, it's like this glorious sacred space. So lots of healing, and addressing both of them will help you to get that healed the fastest.
Thank you so much. Autumn, I want to go to you next, and I want you to talk about this idea about this transition from a disease state to a state of wellness when we talk about our mental health and treating both aspects.
One of the things that's really important, and it's something I like to reiterate to patients, is, we're not really looking for curing anything. We have to look at disease and health on the same continuum. Things are just going to slide from one direction to the other. And ultimately, we want to slide that continuum so we're going towards the healing aspect. Because I really want to, the concept of cure, for example, doesn't really give much credit to, as Janine had talked about, like the journey of healing. It brings with it a lot of components. And I think there's also a really important piece of empowerment that comes from the person when you're talking about disease moving to health, because usually it requires a tremendous amount of participation from the person. When you go into a doctor and you're like, I want to cure this thing, usually you're going in and you're like, I want you to take care of this thing for me. And it doesn't usually work like that. It's usually a piece of involvement from the patient. That's why, we had talked about this team aspect, and we can't really separate, right? There's no separation, not just from disease and health. We all go through, that's part of the human condition, right? We're all going through this interesting human experience, and it's going to come with a lot of different aspects that we have to manage. And it gives us a tremendous amount of wisdom as we go through it, but we have to participate in it. And so that continuum is part of the participation that comes from the patient in their own health, in their own empowerment, that comes from the right tools that they find to help themselves. And then just having this understanding that we don't separate the emotional continuum from the physical continuum. We house our spirit, our emotions, they're all housed in this one human body. And then we have to utilize those aspects of our body to heal on both sides, right? The physiological, the psychological, the spiritual, right? And we have to walk that journey because the continuum, it can slide really deeply into the disease side of it, but it doesn't mean that it can't swing out, right? It's always changing, evolving, and moving.
Thank you.